What nobody tells you about healing after implants. It's really broken into several different phases. Let's start with the acute phase, or the first week. This is when you're just recovering from surgery. So you may be sore and having just normal amount of recovery pain, but the little implant right now is actually really strong. Implants go through a phase of healing where they start really strong and they lose bone integration for the first several weeks before they start to rebuild that bone integration. So the first stage of healing is the acute phase. The next stage of healing is when you're actually building up new bone around that implant. This typically begins around week 9 to 13. This is where the implant is starting to get stronger. And the reason we let implants heal for 3 to 4 months is because the research shows us that in 3 to 4 months, that implant is reaching its strongest point inside of the bone. In fact, some new papers just said that 4 months might be the ideal healing time frame. So you're going to go through the acute phase, the initial phase. You're going to go through the next phase of healing where the implant is integrating into the bone. And then it's just the long-term maintenance phase. So what do we have to do to keep that implant happy over time? We essentially need to keep it clean. The tissue is the issue, but the bone sets the tone. You may hear that phrase multiple times. And what that means is we've got to keep the implant clean around the interface between the implant, your gums, and the bridge. That's why it's important you come in every 6 months for your cleaning and you use your water pick daily and brush your teeth at least 2 times per day. So those would be the phases of implant healing. When done correctly, implant healing actually surprises most people in a good way.